Nose surgery, also known as rhinoplasty, is a surgical procedure that is performed to change the shape, size, or function of the nose. There are several reasons why someone may choose to have nose surgery. Cosmetic reasons. Rhinoplasty can be done to improve the appearance of the nose, such as reducing the size of a prominent hump on the bridge, altering the tip of the nose, or changing the width of the nostrils. Medical reasons. Nose surgery can also be done for medical reasons to correct breathing problems caused by structural abnormalities in the nose, such as a deviated septum or enlarged turbinates. Trauma or injury. Nose surgery may be necessary to correct a nasal deformity resulting from trauma or injury, such as a broken nose. Congenital defects. Some people are born with nasal deformities that can be corrected with nose surgery. Overall, nose surgery can help improve a person's appearance, self-confidence, and quality of life by correcting both cosmetic and functional issues with the nose. Default text. What is rhinoplasty done for? Rhinoplasty is a surgical procedure done to reshape or resize the nose. It is commonly known as a nose job. Rhinoplasty can be done for cosmetic reasons or to address structural issues that affect breathing. Cosmetic rhinoplasty is done to enhance the appearance of the nose. It can make the nose smaller, larger, straighter, or more symmetrical. The procedure can also address issues like bumps, humps, or depressions on the bridge of the nose, a bulbous or drooping tip, or asymmetry. Default text. Functional rhinoplasty is done to improve breathing. This type of rhinoplasty addresses structural problems that affect breathing, such as a deviated septum, enlarged turbinates, or nasal valve collapse. These issues can cause chronic congestion, snoring, or sleep apnea, and rhinoplasty can help to alleviate these symptoms. In some cases, rhinoplasty may be done for both cosmetic and functional reasons. A qualified plastic surgeon can help determine the best approach for each individual case. Unsuccessful rhinoplasty, also known as a nose job, can result in various complications, depending on the specific type of procedure and the individual's unique anatomy and healing process. Some potential results of unsuccessful rhinoplasty may include breathing problems. Rhinoplasty surgery can affect the nasal passages and cause breathing difficulties. This can be due to changes in the size or shape of the nostrils or nasal septum, or the development of scar tissue. Asymmetry. An unsuccessful rhinoplasty can lead to asymmetry in the appearance of the nose. This can result in a crooked or off-center nose, uneven nostrils, or a misshapen tip. Scarring. Scarring is a natural part of the healing process after any surgical procedure, including rhinoplasty. However, if the scars are visible or significant, they can affect the appearance of the nose. Overcorrection or undercorrection. An unsuccessful rhinoplasty can result in an overcorrection or undercorrection of the nasal shape, size, or structure. This can leave the patient with a nose that is too small, too large, or an unnatural shape. Infection. Any surgical procedure carries a risk of infection, and rhinoplasty is no exception. An infection can cause swelling, pain, and other complications that may require further treatment. Numbness. The nerves in the nose can be affected during rhinoplasty, leading to temporary or permanent numbness in the nose or surrounding areas. Revision surgery. In some cases, an unsuccessful rhinoplasty may require revision surgery to correct the issues and achieve the desired result. Revision surgery can be more complicated and may require a longer recovery time than the initial procedure. It is essential to choose an experienced and qualified surgeon and carefully consider the potential risks and benefits before undergoing any surgical procedure, including rhinoplasty. What are nasal diseases? Nasal diseases refer to any medical conditions that affect the nose or the nasal passages. Some common nasal diseases include allergic rhinitis, also known as hay fever. This condition is caused by an allergic reaction to airborne substances such as pollen, dust, and animal dander. Sinusitis. This is an inflammation or infection of the sinuses, which are air-filled spaces located within the bones of the face. Nasal polyps. These are non-cancerous growths that develop on the lining of the nasal passages or sinuses. Deviated septum. This is a condition in which the thin wall between the nostrils is displaced to one side, which can cause difficulty breathing. It's important to choose a qualified, experienced surgeon and to discuss all aspects of the procedure, including risks and benefits, before deciding to undergo a nose job. Deviated septum. This is a condition in which the thin wall between the nostrils is displaced to one side, which can cause difficulty breathing. Nasal congestion. This refers to a blocked or stuffy nose, which can be caused by a variety of factors such as allergies, colds, or sinus infections. Nasal fractures, these are breaks or cracks in the bones of the nose, which can be caused by trauma to the face. Nasal tumors, these are abnormal growths that develop in the nasal passages or sinuses and can be either benign or malignant. Treatment for nasal diseases depends on the underlying condition and can range from medication and lifestyle changes to surgery. It's important to see a healthcare provider if you're experiencing persistent or severe nasal symptoms. Is nasal congestion a disease? Nasal congestion is not a disease in itself, but rather a symptom of an underlying condition. It occurs when the tissues lining the nasal passages become swollen and inflamed, making it difficult to breathe through the nose. Nasal congestion can be caused by a variety of factors, including allergies, colds and flu, sinus infections, environmental irritants such as smoke or pollution, and structural issues such as deviated septum. In some cases, nasal congestion can be a symptom of a more serious condition, such as nasal polyps or tumors. If you are experiencing persistent nasal congestion, it is important to see a healthcare provider to determine the underlying cause and receive appropriate treatment. Nose job. A nose job, also known as rhinoplasty, is a cosmetic surgical procedure that aims to alter the shape, size, or function of the nose. It is one of the most commonly performed cosmetic surgeries in the world. There are two main types of nose jobs: open rhinoplasty and closed rhinoplasty. In open rhinoplasty, the surgeon makes a small incision on the columella, the tissue between the nostrils, and lifts the skin to access the underlying nasal structures. In closed rhinoplasty, the incisions are made inside the nostrils, and the surgeon works through these incisions to reshape the nose. The procedure can be done for a variety of reasons, including correcting breathing problems, repairing nasal injuries, or improving the appearance of the nose. Some people choose to have a nose job purely for aesthetic reasons, while others may have functional issues that need to be addressed. As with any surgery, there are risks associated with nose jobs, including bleeding, infection, scarring, and anesthesia complications. Recovery time can vary depending on the extent of the surgery, but most patients can return to work or school within a week or two.